The American Civil War, fought between 1861 and 1865, was a war that existed on the boundary between old and new. Though not yet the fully modern and industrial warfare that would characterize the 20th century, the Civil War was nonetheless a far cry from the past. The development of new weapons, new methods of communication and transportation, and a new concept of total war that encouraged all Americans to contribute to the war effort collectively marked the Civil War as a military campaign that looked forward to the experience of World War I rather than looking back to the Revolution. The Civil War irrevocably changed the nature of warfare in the United States. And nowhere is that clearer than in the experience of the soldiers who fought the war and the doctors who tried to save them. The Civil War was, in a word, devastating. 4 years of fighting between Union and Confederacy proved deadlier than any single American war that had come before or since. In fact, the total number of American deaths during the Civil War, roughly 600,000, was greater than the sum of all U.S.-involved wars combined until Vietnam. And that's just the number of deaths. Injuries went beyond that, with estimates placing the number of wounded soldiers somewhere around 500,000. The sheer number of dead, dying, and wounded bodies left on the battlefields of the Civil War was staggering, and it far exceeded the ability of mid-19th century doctors to cope. Medicine was going to have to adapt to keep up with the brutal lethality. One reason the Civil War was so deadly was the introduction of new industrial weaponry. Prior to the war, American soldiers typically carried muskets, single-bullet guns that had a theoretical range of 250 yards, but were in practical reality only accurate to about 80 yards. These guns were also notoriously difficult and time-consuming to load, so most fighting took place at close range, with the bayonet often being the weapon of choice in close combat. This had the effect of limiting the number of casualties, a category that includes death, injury, and permanent disability, as well as soldiers listed missing in action, in early wars. A new slate of weapons used during the Civil War began to change that. Arguably, the biggest change was increased military reliance on the rifle, which was responsible for approximately 90% of the battlefield injuries during the Civil War. The primary difference between the rifle and the musket is that the inside of the rifle's barrel is carved with a series of grooves called rifling. As the gun was fired, these grooves would spin the bullet in a spiral fashion, much like throwing a football, which served to increase the distance and accuracy of the shot when compared with earlier firearms. But these early rifles were still slow loading, primarily because of the necessarily tight fit between bullet and barrel. In order to spin properly, the bullet had to be in close contact with the sides of the barrel, where the rifling was, which made them difficult to load. Bullets had to be shoved into the barrel, often using a mallet or other tool, which took precious time and limited their utility on the battlefield. That limitation disappeared with the invention of the Minié ball in the 1840s. The Minié ball, or mini ball as it is sometimes called, was a cone-shaped bullet with external grooves made of soft lead that would expand outward under the pressure of gunpowder combustion. This allowed for a smaller bullet that was more easily loaded into the barrel of the gun, but still benefited from tight contact with the inside of the barrel once fired. This new rifle and bullet combination was accurate up to 1,000 yards, leading to its widespread military adoption and dramatically changing the nature of war. Combined with other advances like the repeating rifle, a rifle that could be fired more than once before reloading, the Gatling gun, a rapid-fire weapon that many consider a precursor to the modern machine gun, and ironclad warships armed with gun turrets, the modern weaponry of the Civil War increased the danger that soldiers face. In fact, a soldier was 13 times more likely to die during the Civil War than during the Vietnam War. And even non-lethal injuries were more devastating thanks to this new weaponry. The soft lead of the Minié ball flattened or shattered when it hit a human target, increasing both the surface area of the damage and the threat of contamination in the wound. They shattered bones and ripped through ligaments, leaving severe damage and increased risk of infection in their wake. After a battle, it was not uncommon for hundreds or even thousands of wounded soldiers to be left needing the services of just a few doctors. As a result, battlefield surgeons had to deal with trauma on an unprecedented scale, which forced them to adapt. Surgeons quickly learned that the best chance for survival after a Minié ball injury was amputation, which made it the most common surgical procedure performed on these battlefields. 3 out of every 4 surgeries performed during the Civil War were amputations. And generally speaking, the sooner an amputation was performed after an injury, the higher the patient's chance of survival. But that was difficult in the early years of the Civil War. One of the primary issues lay in the surprisingly difficult task of getting wounded and dying soldiers off the battlefield and to medical care. Throughout 1861 and 1862, wounded soldiers were often left on the battlefield, as noted by Dr. Frank Hamilton in his 1861 letter describing the First Battle of Bull Run. He describes how wounded soldiers were scattered the whole distance from Centerville to Washington and left with no one to carry them to medical attention. Delay in treatment and exposure could turn even the simplest of wounds deadly, leaving armies on both sides in crisis. Something had to be done. In early summer 1862, Surgeon General William Hammond appointed Major Jonathan Letterman as medical director of the Union Army of the Potomac. The 37-year-old officer was charged with improving the way the Army cared for the wounded on the battlefield. The changes he advanced would become known as the Letterman Plan, and they played a role in the Union victory that was equal to that of any battlefield commander. Letterman inherited the responsibility of caring for a Union Army of almost 100,000 soldiers, some 30% of which were listed as sick or wounded and unfit for duty. Within 2 years, he had dramatically reduced the mortality rate among his soldiers and established a groundwork for battlefield trauma care that is still used today. There were 3 primary components to the Letterman Plan. First, Letterman promoted use of a tiered system of care that involved evaluating injuries and sorting them according to severity. First used by Napoleon's army, this process became known as triage, from the French word trier, which means to sort. It created a system to ensure that those soldiers with the most life-threatening, but treatable injuries would be attended to first. This rapid and tiered deployment of resources reduced the number of deaths due to exposure or thirst, and increased the survival rate of surgery, particularly amputations. Second, he developed an evacuation system involving 3 separate stations: a first aid station on the battlefield, where wounds were assessed and initial treatments were received; a field hospital, located near the battlefield but out of artillery range, where emergency surgeries or additional stabilizing treatments could be performed; and large general hospitals located in towns away from the battlefield, where injured soldiers could receive long-term care. By the end of the war in 1865, there were approximately 400 hospitals with nearly 400,000 beds to serve these wounded soldiers. There were 2 million admissions to these hospitals, with an overall mortality rate of only 8%, which reflects a staggering improvement in military medical care when compared to the beginning of the war. Third, Letterman established an ambulance system to remove wounded soldiers from the battlefield. Using specially equipped wagons and specially trained medics to transport injured soldiers from the battlefield to the field hospital, these ambulance systems were under the complete control of the medical corps. This was important because it meant that those ambulances could only be used for medical purposes, not to transport supplies or help these soldiers, ensuring that they were available when needed. These ambulances allowed drivers to transport multiple soldiers at once, a considerable improvement over the traditional stretcher. These soldiers would be taken to the first aid station, where they were assessed by medical personnel and either treated and sent back to the battlefield or taken by ambulance to the field hospital for surgery. Thus, Letterman's changes brought much-needed discipline to the military medical corps. Still, these advancements could only go so far in the middle of the 19th century, when medical knowledge was still desperately limited. The germ theory of disease, or the idea that disease is caused by microscopic organisms, wouldn't be established until 1870. And the transformative medical emphasis on antisepsis and sterility that resulted from these discoveries was nowhere in sight in the 1860s. Medical training, too, was limited, typically involving only 2 years of lecture-based education and virtually no hands-on clinical experience prior to graduation, meaning that most Civil War surgeons had never even seen a gunshot wound, much less treated one. And though the development of anesthesia in 1846 allowed for longer, more complicated surgeries to be performed, the equipment used was far from sterile, and infections were common. The Civil War was still the deadliest war in American history. But the changes that Letterman brought to the Union Army of the Potomac Medical Corps saved lives and transformed military medicine, a feat that shouldn't be underestimated. Thank you for your time.